Hi, my name is Dr. Smith. How may I address you?
Tanya is fine.
Tanya, very nice to meet you, Tanya. And what brings you in today?
Honestly, I'm feeling really stressed out.
And can you tell me a bit more about that?
Well, my husband, Jack, and we've been trying to get pregnant, and it's just not happening.
Okay, it must be very stressful. And how long have you been trying for?
We got married about a year ago, and we've been trying ever since.
I see. And have you ever been pregnant before?
No.
And how often do you have sexual intercourse?
Usually every 3 days or so throughout the cycle.
All right. And you time your ovulation cycles?
Yeah, I got some of those ovulation sticks from the pharmacy, and I've been using those.
All right. Okay, that's good. And are you having regular periods?
Yeah, every 28 days, but they weren't always regular.
I see. Okay. If you don't mind, I'll be just taking some notes. Can you tell me a bit more about the time when they weren't regular?
When I was younger, they were irregular, and then they started to become regular around when I was 16.
I see. All right. And now the regular every 28 days or so?
Yes.
All right. Okay. And how long are your periods?
Usually around 5 days.
During the heavier days, how many pads or tampons are you going through?
My heaviest days are the first 2, and I probably use around 4 to 5 during those days.
All right. And are you experiencing any pain throughout the periods?
No, just mild cramping.
And what about the sexual intercourse? Is it ever painful?
No.
Got it. And so obviously it takes 2 to get pregnant. And do you mind me asking a few questions about Jack?
Yes, of course.
All right. So do you know if Jack had any kids in the past with any previous partners?
Yes, actually. He does have a son, but he's no longer in contact with him.
I see. All right. Is Jack ever having any trouble having or maintaining an erection?
No.
All right. And any trouble with ejaculation?
No, nothing like that.
Got it. Are you aware of any surgeries or any medical conditions of Jack's?
No, not that I know of.
Okay. And is he taking any medication at all?
Just a daily vitamin.
So I would like to know a bit more about your medical history, if you don't mind.
Of course.
So do you have any medical conditions?
I had strep throat when I was younger, but nothing since then.
All right. And have you had any surgeries, more specifically any surgeries in the pelvic or abdominal area?
Luckily, so far, no surgeries.
I see. All right. And we know that sometimes a history of sexually transmitted infections can impact your fertility. Have you ever had any sexually transmitted infections?
Yes, actually, I have. When I was 17, I did have gonorrhea, and the doctors gave me an antibiotic, but they had to keep me overnight in the hospital so that I could have the antibiotic through IV. I don't really remember what it was called, though.
I see. Well, very sorry to hear you had to go through this. And any fertility issues that run in the family that you're aware of?
Yeah, my sister, she had a miscarriage, and my mom, she always said that I should have had a brother, but he died when she was 36 weeks pregnant, and I think we even had a funeral for him. It was really awful.
I'm so sorry to hear about that. Would you like to talk a bit more about this?
Thank you, but I'd actually prefer not to for today.
No problem at all. Do you have any family history of any medical conditions, more specifically any genetic disorders?
No, not that I know of.
So it's just like to make sure that I'm not missing any other causes that could impact your fertility. So do you mind if I ask a few more questions?
Sure, go ahead.
Have you recently noticed any hair growth around the chin or the nipple area?
No.
All right. And any new acne that you noticed?
I suffered from acne back when I was a teenager, just when I was having those irregular periods that I mentioned earlier. But since then, no.
Fair enough. And have you experienced any headaches recently?
No.
What about vision changes, maybe double vision?
No, nothing like that.
All right. And any changes to your stool at all? It could be constipation or diarrhea.
No, it's pretty unchanged.
All right. And have you noticed any changes to your skin at all?
No, I don't think so.
What about your hair?
No, not that I've noticed.
Have you noticed any hot flashes or vaginal dryness?
No.
All right. And how about any fatigue?
Yes, actually. I think just everything's just been really stressing me out, and because of that, I'm not performing as well at work because I'm not concentrating that well.
I see. And do you mind telling me a bit more about your work? What is it you do?
I'm a nurse at a fertility clinic.
I see. And do you mind sharing what happened at work?
Well, it was actually really embarrassing. I'm around pregnant women a lot with my work, and because I'm trying to get pregnant, it really upsets me. And about a month ago, I was with a patient and I actually had to leave the room because I started to cry, and my manager was really upset about it. And honestly, it's making me not enjoy my job anymore like I used to. But I have to keep going because Jack's not working and we really need the money.
I understand. I mean, I'm so sorry that you have to go through all this. And how do you feel about all that situation and what happened?
I just feel like a failure. I feel like my marriage is about to fall apart.
I'm so sorry to hear that you're going through all that. And first of all, you're not a failure. This is definitely not your fault. And do you have anyone you can talk to about this?
Jack is really supportive, and my sister really understands what I'm going through as well, and we've been talking about it a lot.
Okay, that's great. And do you have any ideas of what can be impacting your pregnancy?
Well, I've been reading a lot about it, and I think that it's from my birth control that I was taking when I was a teenager, because I've heard that that can cause infertility, and I'm just worried that I was the one who caused my own infertility.
Well, to reassure you, there is no evidence that suggests that oral contraceptive can cause infertility, especially if it was taken such a long time ago.
That's really great to hear. Thank you.
So what was it that you were hoping to get from today's visit?
Well, I was just hoping that you could refer me to a fertility specialist, preferably not the one that I work for. As well, I was hoping to get some blood work done to check it out.
Okay, so before we discuss our plan, are there any other issues that you would like to share?
Now that you mention it, I have been having trouble sleeping as well.
Okay, can you tell me a bit more about that?
Well, I feel like I'm just so stressed out and I can't get sleep. And even when I fall asleep, I wake up in the middle of the night and then I can't fall back asleep, and I'm just not sleeping.
I see. I mean, sorry to hear that. And any particular reasons why you're waking up? Do you ever find yourself waking up and gasping for air?
No, nothing like that.
Okay. And maybe your partner has mentioned that there is any irregular movement that he has noticed. Maybe you're sleepwalking.
No.
All right. And do you feel like you're anxious or depressed?
I feel really stressed out, but honestly, I don't really feel anxious, and my mood has been surprisingly fine.
I see. And I mean, a lot of the time our daytime activities can be linked to the sleep or lack of sleep. And caffeine is obviously one of the factors that could be impacting it. Do you drink any coffee or any other caffeine?
I do. I drink about 2 to 3 cups of coffee every day, and lately I've even had to drink more because I'm just so tired all the time. So now I'm drinking maybe 5 or 6 cups of coffee, and I know it's a lot.
I see. All right. And do you take any other substances?
No, I don't even drink alcohol. I smoke about 3 or 4 cigarettes a day.
Okay. And any illicit drug use?
Oh no, nothing like that.
Like cannabis?
No,
Cocaine?
definitely not.
And I mean, sometimes the lack of sleep can really impact our day-to-day functioning. So, do you drive to work, or if you do you find that you doze off?
No, I don't usually drive much. I take the bus to go to work.
Okay, all right. And do you take any naps throughout the day?
No.
How about exercise? Do you exercise at all?
No, but I know that I should.
All right. And so overall, with all this lack of sleep, do you find that it impacts your day-to-day functioning?
I feel like I'm not performing in any of my roles. I feel like I'm not performing as a wife or as a nurse even, and I just feel useless.
Well, I'm so sorry you feel that way, and I mean, you should really not blame yourself for any of this. This is absolutely normal what you're going through. I mean, it sounds like you're experiencing symptoms of burnout. Is that fair to say?
Exactly. Like I feel like I don't want to do anything anymore.
So, how has the lack of sleep impacted you in other ways?
I mean, I guess it's affected my sexual desire. Like I feel like I don't have the energy to have sex anymore, but I want this baby so badly.
That's fair. And how are you hoping that we could address this today?
Well, I was hoping that you could help me and make sure I'm getting more sleep, but at the same time, I don't want any medication because I am still trying to get pregnant and I don't want it to affect the baby.
So I see you have a lot going on. It seems you're trying to get pregnant, and it has been very difficult for you and your partner. It's impacting you and your work. Lack of sleep is obviously not making things any easier, and it seems you're experiencing symptoms of burnout. Perhaps we can talk about some solutions to all the things we've discussed.
Yes, that would be great. Thank you.
All right, perfect. So let's start with the fertility concerns. So first, I would suggest to continue having sex 1 to 3 days throughout your cycle. And the other thing is smoking. As you know, it could impact your fertility, and it would be great if you could consider quitting. Would that be something that you can consider?
I haven't at this time, but I'll let you know if that changes.
Fair enough. I mean, we do have a nurse who specializes in smoking cessation. And whenever you're ready, I'll be happy to connect you with her so she can help you out.
Thank you.
In terms of exercising, I mean, this is something that could help with both your fertility and your sleep. So do you think that you would be able to incorporate in your day, maybe even 15 minutes a day to start?
Yeah, I think I could try that.
All right, so for the fertility concerns, we're gonna start with a physical exam, if you don't mind. And then we're going to do some tests. So as a fertility nurse, you probably know all the items we're going to be checking in your blood work. So we're going to make sure that you're ovulating, and we'll be testing for such hormones as serum progesterone, prolactin, estradiol, LH, FSH, TSH. So we'll also check your rebellion immunity, and we'll do a specialized ultrasound to look at your reproductive system.
Okay, that sounds great. It's exactly what I was hoping for.
All right, perfect. So while we're doing all that, I'll also refer you to a fertility specialist, if that's okay.
Yes, please.
So I'll also recommend that you start taking a prenatal vitamin with folic acid.
Okay.
All right. For the difficulty sleeping, I recommend limiting your caffeine. Do you think that would be possible, or maybe at least consider decaffeinated drinks?
That's going to be a tough one, but I'll give it a try.
So I would suggest you don't take any naps throughout the day and use your bedroom only for sleep and sex.
Okay.
All right? And we know that there is some evidence that show that muscle relaxation can help you with your sleep. what I could do is provide you with some online resources that you can look at and consider doing some meditation.
That sounds great. I do love meditation.
Fantastic, perfect. So another thing that I'll ask you to do is, would you be able to maintain a sleep diary? So this way, we'll be able to track your sleep and kind of look at your sleep hygiene.
Yeah, absolutely.
Can I refer you to a psychologist to review cognitive behavior therapy and sleep?
Yeah, I've actually been reading a lot about that, and I think it would be great.
All right, perfect. So what I would want to do is have a follow-up in 2 to 3 weeks. So we're going to have some of the results at this point, and we can review those. Also, we can review your sleep diaries and see how your sleep been progressing. And it does take two to get pregnant, and it would be great if maybe your partner could join us as well, and we could involve him in the conversation and maybe even run some tests for him as well.
Okay, I didn't even know that that was an option, so that sounds great. He doesn't have a family doctor.
All right, okay, that's perfect. I'll love to see him.
Okay, thank you.
Perfect, thank you.